Welcome to Take Flight episode 91. On this week's episode, we are going to be talking about the vaccination. So, there's been an uptick in cases of COVID due to the new Delta variant. On this week's episode, you are going to find out which two people on the podcast have been vaccinated and the other two that haven't been vaccinated. And then we are going to talk about our views on why we believe that there's such a low adoption within the Black and minority ethnic groups. And then we talk about should vaccinations be mandatory. Also, we talk about what next. So, what do we expect to see in the future when it comes to the vaccination? So, stay tuned and let's get started.
Take off, take flight with you. For we never fly, but we're flying.
Let's get into this, man.
Okay, everyone, welcome to episode number 91. How is everybody doing?
We're in the 90s now.
Are we 9
We're
away?
in the 90s.
Are we 9
90.
away?
Yeah,
Ooh.
9 away. Crazy, right? How's everyone doing? I think we should start with Shiwal.
Rumors are that the episode 100 is Pete. It's your episode, so you got to bring the fire.
Exactly.
Let's see if it works out that way. I might just do. Okay, I've got an idea.
So why don't we start off with Shiwal? If you're able to see the visuals, you'll be able to notice that Shiwal has been tanning. He's almost the same complexion as me. If you have the visuals,
That's the goal. That's the goal, Oli. No, it's good. It's good, man. I've been pretty much the last 2 weeks in swim shorts and no t-shirt for the most part, and it's been great, man. It's been a nice way to recharge and do a lot of things that I haven't done before. So it's nice. I just came back and now recording this episode with you guys. So it's a nice way to get back into the swing of things because there's a lot to do in the second half of the year. So it's a nice pause before then.
Trust me. Can you share any maybe of any reflections that you may have had? Because it's middle of the year, you get a break. There may have been some deep life reflections that would be interesting to hear. Maybe you can do it. Go on.
Yeah.
Put you on the spot.
Yeah. So there weren't any deep life reflections. I think the one part is I was thinking I would love to do this all the time, like just to have rather than just 2 weeks living like that, make it 6 weeks. So that's really the one thing. And other than that, just really enjoying the moment. And like I did fishing and swimming and all this stuff that I wouldn't normally do. And it was nice to do it. And yeah, it was good. But now, yeah, the to-do list is wild right now between now and the next couple of weeks. So no, it was a good break. Highly recommend Mexico and this other country called Belize that I went to. For anyone that hasn't visited, I've got some great tips. If you're interested, I'd be happy to share. But no, it was a good break. And yeah, the tan is feeling good. I don't think I'm as tanned as Olu yet, but that will be the goal for the next visit. Maybe after 6 weeks rather than 2.
One of these stories, yeah, I just caught myself watching it to a point where I didn't even react to it. I was looking at it thinking, oh my God. You know the one where you're sitting down at the end of the yacht? Orange. I said, Lord have mercy. What's going on? I said, is this heaven on earth? The guy was looking bronze, mate, and I just said to myself, "Yo, you know when I'm looking at it, thinking to myself, fam, we used to do this thing back in the day, you know." That's a different thing. You get me?
And someone's clearly still doing it, but someone stopped.
Yeah, boy.
he was about to tell his family.
I had one of those moments. I was thinking, wait. No, I'm playing.
What about yourself, P? You were off as well. How was your week? It was a different sort
it was alright.
experience.
It was different.
Yeah, it was alright. No, it was perfect. No, it was really good. So I had pretty much 2.5 weeks off. Like I was able to really disconnect from work, and not only when I say work, I mean all types of work. So property related, work related. And I literally made it a point to do nothing, which sometimes I struggled with, but it was just great to be able to sort of disconnect mentally as well. So myself and the family, we done some long weekends, Switzerland trips, and we just basically did whatever we wanted, which was cool. We had no agenda, and it was literally, what do we feel like doing? Let's do it. We can do it. We're together. We're not looking at the time. We're not worrying about work on a Monday morning. We're not worrying about, the next property deal. We're just literally spending time together. So it was really, really, really good. A lot of fun. And similar to Shua's reflection, you find yourself in that space where you're just thinking to yourself, this is what I would love to do full time. It will take a long time for me to get bored of doing this. But I also appreciate the work. But again, it's one of those reflections you have.
Cool.
So it's good. So I got a couple more days left, and then I'm back to work on Monday. And yeah, like Shua said, I think from August, September, October, November will be a serious set of months to finish strong, and then wind down in September, in December.
What about yourself, Daniel? We recorded later today. Do you want to share that? Why we recorded? How's that transition going?
I'm back at work.
You're back in the
Enough
office.
said.
Touchy subject.
Yeah, real touchy.
How is the commute?
As of the 19th of July, I'm back in the office. It's an interesting one, to say the least. Having to adapt back to commuting is very different. The different type of, I would say, the exercise mentally is different. Having to, commute to the office, to interact, to almost be working full out whilst in the office, and then having to commute home. It's a very different feel and look to the working from home sort of life. I think the first 3 days, I haven't necessarily had the best experience, given there have been a number of train cancellations. So the first day I went into the office in the evening, a load of trains cancelled. I had to leave a bit early. Tuesday morning, train was cancelled in the evening. Didn't get home till after 8. And then on the Wednesday, more issues again. So I haven't had the most pleasant experience, which of course isn't, the nicest first week back. And I found in the evenings on the way home, I'm out like a light on the train. I'm out. Like,
Are you the
my mouth is open.
Are you the last
My mouth
stop?
is open, but the mask is covering.
Are you the last stop? So at least you don't miss your. Huh?
Nah, I'm not the last. Not the last stop.
Okay.
I never miss my stop. But actually, yesterday, it was yesterday. I was sleeping on the train, and I woke up. I didn't know where I was. I was just looking around. I didn't know where I was. I had to look at my watch to find out. Okay, this isn't. I wouldn't necessarily be at my station at this time, so I'm good. But I was out. I was telling P this. I was just out, tired. Get home, do a quick workout, and then it's almost time for bed, and then repeat. So
That's the process, boy. That's the process.
it's trying to get back into the swing of things.
And like for the two guys that were on vacation, what's your reflection, I guess, of those?
Oh, you don't even want to hear his reflection. Trust me.
What's your reflection of the experience? Or you don't want to share?
Daniel,
You're asking
Me?
Daniel, right?
Yeah,
you're
Daniel.
asking Daniel, yeah.
Okay.
No, I'm just saying. No, it's similar to
reflection
like
going back to work.
Yeah.
Oh,
going back
sorry,
to
so
your reflection. Yeah, similar to that.
Oh.
That's right. You don't want to know. You don't want to know. You don't
Let's just say, talking to other colleagues, people seem to have the same thoughts. Put it that way.
So similar to Apple.
No, not necessarily Apple, but in just terms of speaking to trusted colleagues and ones where we can have open, candid conversations, people are sharing and feeling the same sentiments. But of course, I haven't shared those sentiments, so you don't know what they are. I haven't shared them on the podcast publicly, but I think I've spoken to you individually about what those sentiments are, whether they be positive or negative.
It's like I guess it might be similar to like Apple, where their employees wrote a harsh letter on wanting to change the working arrangements. So we actually did an episode. It was episode number 85, which was the time to return to office. So if you haven't listened to that yet, go back, listen. It was a really interesting episode where we shared our views about returning back to work post-COVID.
But
cool.
Olu, how are you? I must say, my highlight of the last weekend was meeting them both finally and officially.
Oh wow! So Daniel,
Yeah,
you met Bo in person.
Daniel came to visit me on when was it? Saturday or Sunday? I can't remember. Sunday. Daniel called me, said he was around. Impromptu visit, came to visit Bo. Bo was excited to see him, like always, jumping up and down. No, it was good. It was good to catch up with Daniel. I hadn't seen him for a long time, but we enjoyed it. In terms of myself, the prior week I took a few days off, so a couple of days to do like a UK stay vacation. Reflecting on it, I hate UK stay vacation. I prefer to travel because when you
You
look
ain't
at
going
how
to the
much
right places.
Nah, when you're looking at how much you're spending for hotels and stuff in the UK, I'd rather be abroad doing that, right, than being
Oh,
in the
you
UK
okay? I
person.
thought you meant you
But,
stayed in your apartment just chilling
No. So
around
no,
your area.
but Olu,
actually,
I'm I'm surprised. You're usually like the king of deals. So I know what you
Yeah,
mean when you
Groupon,
say
Groupon, innit?
staycations are expensive in the UK. I definitely agree. You know, we've been looking as well, and you know what you pay here, you can easily just fly abroad and get somewhere in Europe.
exactly.
But usually you're the king of deals. So why didn't
Yeah,
you
but
find
deal
anything with
here
Groupon or
in
anything?
comparison to deal abroad, it's still better to be abroad in that sense. Part of me was like looking at Chihuahua's videos and saying, "Oh, maybe I should surprise him out there."
I think that's a nice segue into the episode, because maybe you wasn't abroad because you're not vaccinated. So maybe we can take it there.
Yeah, we can go.
Why didn't you
Yeah,
go away?
let's.
Yeah.
So
Yeah.
I
Who's
didn't go
dishing
away,
out the jabs?
not due to not due to vaccination restrictions. But let's switch over to this episode. So I really wanted to talk about vaccination in minority ethnicities. So what we've seen recently is that there's been a spike again in sort of the COVID rates, especially with the Delta variant. So the main difference between the Delta variant, sort of based on research right now, is just that it's more transmitted. So previously, the normal strain, it would be passed on between sort of 2.5. This one transmits itself at a 4-person rate. So one person is transmitting it higher. So we're seeing a drastic amount of people catching sort of COVID. The spike has come back up again, where different countries are now starting to talk about restrictions. And it got me looking at sort of vaccinations and trying to understand where it stands to vaccination. Because as soon as the vaccine was supposed to come out, it was supposed to be rolled out. The majority of people were going to take it, and then we could say goodbye to COVID. But we're seeing a low adoption, especially in Black African, Black Caribbean communities, especially in comparison to white communities. And I just really wanted to talk about in this episode. First question, I guess, is let's just go around and find out who has been vaccinated, who hasn't been vaccinated. Even though nowadays it feels like it's a sensitive conversation, similar to like religion, right? Shouldn't be spoken about. But I think it'll be good for us to just first answer that question and then understand
So you want to
why.
just simple yes or no? Okay, go
Yes
ahead.
or no. So I'll go first. So I am vaccinated. I've had my first jab. Waiting for my second.
So you're waiting for fully 5G upload, yeah?
This is not conspiracy episode. Go on, Shua.
I'll tag on to Olu. So I'm in the same position as Olu. I'm one vax down. I've got my second one booked to be fully vaccinated.
So I knew about Shaw. I didn't know about Olu.
Okay, so what
So
about you?
who's next?
Daniel, we might as well just turn this into a 2 versus 2. So
In it? Because I dish out the jabs, I don't receive them, bro.
So I'm not. Just quickly, just to answer the question, I'm not vaccinated.
Cool.
Same. I'm not at the time of recording. I am not vaccinated.
But
Okay.
do either just to clarify, do either of you have an appointment booked, or you're not planning on?
I haven't got an appointment booked.
Yeah.
And
Like
Pablo?
I'm trying to be serious about this. I don't have an appointment booked either.
Okay, clear. Only because Olu and I both said that we have our second appointment plan, so that's just to clarify that.
So let me just
Olu, over
understand.
to
I
you.
guess why don't we start with
Maybe I just go as far as saying I haven't seen one doctor during this period.
Okay, cool. So why don't we start by why we believe the adoption level, especially so if we look at this podcast, right? 50% of us have been vaccinated, the other 50% haven't, right?
It's high.
Why do we feel like the adoption rate is so low in Black and ethnic minorities? So why don't you start with UP? Why do you think it's so low? You seem like you
You know, what's interesting about this. I think what's interesting about this episode is because how do you have a discussion without veering off into sort of your
Conspiracy
conspiracy
theories.
type conversations. Anyways, but no, I think to be
Hmm.
maybe a bit, I don't know, objective, or to have a mature conversation. I think. Sorry, Olu, question again. What's the question again?
So I just want to understand why
Don't you like?
is there such a low adoption, especially in the black? Why do you
Yes,
think there is?
yeah. So I think, so my personal opinion, I think it's a lot to do with how certain ethnicities trust the medical and healthcare systems, and I
Mm.
think over like historically, right? So I think even before you even talk about vaccinations, what's our history with actually going to doctors and just going for a regular medical checkup, right? That's low in itself. So when you talk about a vaccination, which many people have spoken about, it's come too soon. There's a lack of data. There's a lack of long-term data. People then go into the space of, do I trust that in order to have myself vaccinated? So I think what's happening is people are looking at the data that they can actually get themselves hold of, and they're making a decision based on what they think feels right at that point in time. Now, I think that a lot of people have changed their minds over time, but I think it's about trust. It's about how much do you trust the healthcare system.
When you say people are getting hold of the data, right? I don't believe that statement. And
No. When I say data, I mean like anything that they can actually read and see. So information online. I mean data in general. I don't mean like statistics. I just mean what they're
okay,
able to
and I think
access.
that's where,
Information.
and that information I think is where I think is driving a lot of the low adoption, where we see on like social media, people leaking or speaking about conspiracy theorists, right? And I think one place, and I spoke this to, I said this to Daniel, right? And one of my views is, I'm always careful who I take advice from, right?
Yeah.
And think as soon as the vaccine started coming out and rolling out, I started to see so many woke or so many people come online that some don't even have GCSE degrees trying to give me medical advice, right? And I'm like, what qualifies you to give me medical advice? Like, it's like me wanting to be a billionaire, right? And I'm gonna go and see my guy at the chicken shop telling me, yo, this is how you
Crypto's
do
going
it.
forward.
Like, yeah,
Crypto's going
this
forward.
like
Forex trading.
Forex, like I'm not gonna listen to that advice. And I think that's one of the elements. I do definitely believe, yes, there is a history in terms of black people and their health systems, right? But I think when I hear conversations about, okay, how quick this was developed, I expect vaccinations to be developed quicker as technology is improved, the spending has increased. When we compare it to stuff like previously where there was the yellow fever, right? I think it was Rockefeller was the one that actually developed that, right? They spent around 8 million. If I convert that to this time's money, you're looking around 140 million today's money. In terms of the vaccination and development, governments across the world spent close to 93 billion. If I'm spending that much money on that resources, I'm expecting it to be quicker than, but that
What's the
doesn't mean
ROI
it,
in it?
Yeah,
that
but I
doesn't,
think
that doesn't
if
mean
you,
they're cutting, that doesn't mean they're
yeah.
cutting corners. Also, they've studied vaccinations and studied vaccines for years, technologies and stuff like that. So I'm expecting it to become quicker, right? Then now we're gonna go to it later on about like should it be mandatory, etc. Then that's a completely different conversation. But I try to take my advice from experts in my, so that's me talking to
But then
fellow
Olu,
doctors that I know. Yeah,
I think
conversely though, how do you know those doctors aren't unbiased? I'm not saying that they are,
because they're
but
jabbing themselves. So if you
no,
are
but it
putting,
doesn't matter if you're jabbing
no, but
yourself.
that's
Someone could be
that's
snorting cocaine and say, "Yeah, it's good for you. Go on, take
no,
it."
but yeah, that is. But again, it goes back to our point about the educational level, right? I believe that
Of
the
course,
friends
but
that I
then
know, the
you
doctors that I know are educated individuals, right? If they're
yes.
snorting coke and they're telling me to take it, they obviously know the side
Okay,
effects because it's
so
going to happen to them.
what are those who run in our country doing? Those MPs, some of them have even come out and outright said that yeah, they smoked, they snorted that Charlie, Michael Gove. But all those who are running our country, we put trust in them. How do we know they haven't got a hidden agenda? I'm not saying they do. I'm not trying to sound like a conspiracy theorist, but I'm just trying to be objective and say outside of the box. I'm not saying they aren't educated.
Yeah.
But when there's an agenda, they
Yeah.
want people to buy into it, whether it's vaccine or anything else, you know, besides the vaccine. They want people to buy into it. So there's going to be some sort of persuasion and some sort of coercion for you to do it, because if you don't, these are the side effects, or these are the ramifications of not doing so. And like you said, of course you want to get information from those who are qualified and those who are experts. You know, like you said, you don't want to go to someone who's, well, most people that wanted to take the vaccine that I know of, like, said, well, I've put worse stuff in my body. I've taken, coke, drugs, all this other stuff. This ain't gonna do jack to me. I don't mind.
This ain't gonna kill me.
But, yeah, but I'm just trying to say, when there is a huge emphasis on something, I know there's been research, there's been money put behind it, which is one of the main things people say. Oh, how can you create a vaccine so quickly? Part of developing a vaccine is funding. Of course, there was billions of pounds, because countries were also racing to be the first, country to produce a vaccine against COVID-19. But it also raises the question of, there are many other diseases and viruses that have been around for years, that have killed millions, that continue to kill millions. Why can't we tackle those same problems with the same technology and research put behind COVID? Is it because COVID is a global pandemic, whereas other diseases are
exactly,
that's what I learned,
so
endemics?
I think it's two reasons, right? One is a global pandemic, like you said, and two is how it transmits itself in terms of airborne, right? So the other vaccines that you might talk about, like HIV, or the other viruses or illnesses that they can be resolving, like HIV, this and that, is not as transmitted in such a frequency or pace as this particular virus at the time. So that's why you see them focusing on this versus other things. And I'm not gonna say that. At the end of the day, when people say, "Oh, there might be a hidden agenda," if you don't have the evidence that there is a hidden agenda, now I'm not gonna just say there must be one, right? At the end of the day, you've got to look at the data. People have died based on this. It's as simple as that. People have died, right? So they need to, and economies have shut down, right, which has affected them financially. So they need to try to resolve this as quick as possible to get back to some level of normality. That's my personal view. What about yourself, Shuab?
But so just to interject there.
Wait.
I sort of saying that people have died. Yeah, I know, and that's tragic, and of course that's very, that's not good. But at the same time, it's almost as though there's a huge emphasis on this, that everything else is disregarded. Because last Monday, I think it was the 19th, there were 200 and something deaths in the UK related to COVID. Of course, those are deaths and those are human lives that were lost. And of course, that's not, that's never nice. But on the same day, there were close to 1,500 deaths caused by pneumonia. Why don't we ever, or why haven't we historically said, in the winter months, reported on daily figures for the deaths related to flu or to pneumonia?
Zoom out. What is the deaths on pneumonia in a year versus COVID in a year?
Oh, it's a lot higher. I haven't got the figures right in head of me.
Globally, I'm talking globally. Globally, I'm talking globally. Which one is higher? And I'm going to say it's going to be COVID. If you zoom out, prove me otherwise.
I'm going to say possibly, but I also don't feel that all the deaths that are COVID related are actually COVID related. They're just gonna, they want to magnify that number. They want to magnify that number because they want people to take the vaccine.
No. I think it's two things. Let me just say something with Daniel, right? Sure. Yes, not all the deaths were. I agree. Not all the deaths were just COVID related. But what has been proven right now is that COVID does mutate, right? So the initial strain, if not resolved or addressed, could get to something more deadly, like Ebola, deadly wise, but more transmitted, like what we're seeing right now, where it's 4 times, right? If this becomes more transmitted and more deadly, then people will turn around and say, why didn't we address this time ago?
Okay, wait.
Are we seeing that currently with the Delta variant, right? Are we not seeing that with the Delta variant?
Yeah, just a couple of things, and then we go to Shua. So going back to your question, Olu, in terms of why we're seeing low adoption rate, I think your conversation with Daniel speaks to that point. I think it's what's happening now with globalization in terms of information. It's difficult to know what information to trust because people are at home and they're seeing both sources. They're seeing people thinking about this potentially being a conspiracy theory, which makes you think and it gets you to reflect. And then you're thinking, okay, well, there is a lot of funding. Usually a vaccine takes 7 years to produce. It's very complicated. So maybe this one's going to be a lot faster. So then maybe you think there's something. So I think it's about what do you trust? And then the other thing I wanted to probably say, why maybe there's a low adoption rate. I think I don't have the facts per se, but there is known to be, you have some ethnic groups which are always tend to be the first to be tested, and sort of understand how a vaccine would work in their bodies before it's then rolled out to other communities. Daniel, so that's one of the reasons why people are wondering, why should we be first, right? I know that's been a discussion.
Well,
and then
are we being first in this scenario? Because the data says that the low adoption is so we're not the first. Let's be honest here. We're not the first with this particular.
And we never are.
When you say
never are.
I'm talking about like Africa, for example. They usually take countries like, and they
Africa
test
to do the test. But I'm talking about, agreed with that. So I'm talking about, this has already gone through the trial stage, right? Now we're rolling out the vaccine, right? We are not the first ones. If we look at white people, they have already 90% sort of adoption and use, right? The black community is lower. And also the data shows we are more likely to even die from COVID due to multiple stuff like the socialist, economical, diabetes, all of these health issues, right? We're more likely to die from it. So the slow adoption is holding us further back, right? Because let's be honest, right? If some people do catch this and it's very severe in our and I don't like to use the fear factor, but if they do they have the economical ability to be able to get the best care? And then if they do get the best care and then there's some long-term effect, how is that going to impact their family in terms of now losing a person that's able to work in that family or household? So those are all the factors I'm trying to put together. But Shawal, you being quiet.
Very last thing before we go to you, just real quick, because you mentioned Ebola. I just wanted to just plug this in there. So
Ebola came and went.
No. Whoa. Wait. One question is, what happened to Ebola? That's just a question. You don't have to answer, but that's just out. That's just a question I want to put out there. But I think what's interesting is, I was obviously much younger at the time, so I didn't maybe have the sort of foresight or the way I reflect now on certain things that happened globally. I just remember walking with my dad, who was in Germany. He was walking along the lake, we was just talking, and I remember him saying this, and I always thought to myself, the best place to, like, when things like this happen, COVID and these things, speak to the OGs, because they will just put things in perspective to help you understand what maybe you should be trusting and not trusting. So this is what he said. He just said this one line. So I said, Dad, what's your thoughts on Ebola? Because it's back home, and are you thinking about family back home? And according to what they were basically saying was that Ebola was bushmeat, right? Bushmeat.
Yeah.
He said that Africans have been eating bushmeat for years. Why is it now a situation? And just left it like that. And I was like, oh boy, see how the media does things. So yeah, that's he said that, and I was like, cool.
So at dinner you had bushmeat.
No.
You said let me hold out.
But he just, in one line, he just says we've been eating bushmeat for years. So why now is it coming up? And I just thought,
and it disappeared off the face of the earth.
And it disappeared off the face of the earth.
Yeah.
So, sure, please
take it away.
Okay, so
the question is, sorry, the question is about low adoption rates. I know you're probably thinking.
I know you're still on holiday.
That's a good boy. What a topic to get into. Just coming back off of a holiday and probably taking about 100 COVID tests. So on the adoption, I think, and just to reference the data point that Olu was saying, so there's this Bloomberg article that we probably share as one of our posts related to this episode on our Instagram. There was a graph which is about vaccine hesitancy, and what they did is they got adults of they basically took different ethnic minority backgrounds, and they put a percentage against them on how much they're hesitating to take the vaccine. Now, the white demographic was at 8%, which is very low. The highest was the black community, which was 44%, reporting that they had vaccine hesitancy to basically get the vaccination. So that's, and then the other demographics are basically somewhere in between. If I just give some personal reflections, so I think with COVID, as I mentioned, I'm already I've got one of the two vaccinations. My parents both have been vaccinated. At the point where they were asked to be vaccinated, was there any hesitancy with them? I didn't observe any. But I've also seen that their evolution of COVID and thinking has also evolved over time. At the beginning, both of my parents were taken aback by the news, as the whole world was. Then things went into lockdown. But I think for them, the trigger point was when people around them either got
Yeah.
COVID and were seriously ill, or got COVID and passed away. And the Bangladesh demographic, similar to South Asian and also the Black community, I think, Olu, you've already mentioned, these are the communities that when they do get COVID, there's a higher chance of larger implications, because they're coming from a base where their health isn't as good. I know in the Bangladeshi community, people of my father's age, around 60 to 70, they're much more likely to have diabetes, much more likely to have cholesterol issues, much more likely to have blood pressure issues. Now, if you have all of that and you add COVID, then there's a high likelihood that you will be hospitalized. So when the vaccination rollout came about, my parents didn't hesitate to get their vaccination. And at least from what I've observed, their friends of a similar age, their peer group, also haven't been as hesitant. So I think the reason why they adopted it so quickly is because they saw firsthand what happens when people get it, and also some of their close friends and family members were hospitalized and seriously ill. So that was the trigger point. Now, I think the reason why maybe it's lower adopted in other cultures, I think it all comes down to trust. And if you see from that graphic that I just mentioned, the Black community is at the bottom at 44%, which is almost 20 to 30% higher than the next demographic in line. And I think it all comes down to trust with the local authorities, with the government, with the public health services. And that comes from historical issues that have happened in the past. So I think it's difficult, because I think my parents only did it because of what they saw firsthand. If other communities haven't seen that, if everyone of our parents' friends are actually okay, or some got COVID and it was a mild cold, then I think it'd be difficult to convince them to get the vaccine. It comes down to trust at the end of the day.
Yeah, no, I just want to jump on that actually, maybe just to provide a perspective on how my parents have thought about it, because I think Shaw mentions a great point around, so one of the strongest data points has actually been people around you contracted it and maybe not necessarily recovering, or they have recovered, and that's actually swaying on people's decision. So my mother actually caught COVID at the start of 2020, well before it was actually some COVID. There were cases where it was like same symptoms. She recovered. So because she recovered, in her mind, she sees it as it's just like any other flu or per se, and I've covered, so I'm okay. So her position at the moment is I'm not necessarily racing to take the vaccination. My dad, on the other hand, bearing in mind they're both obviously in that age bracket where you're considered to be high risk. My dad, on the other hand, what's interesting with him is when it first started to um, pick up momentum, he said, "Oh, I'll take my time." He's a doctor, by the way, just for the listeners. I'll take my time and just see how things plan out. But he had been at home almost for a year and was planning to fly to Africa. So in his mind now, he almost kind of done it from a lifestyle standpoint. I need to sort of get out, move my mental health. I still want to go ahead with my plans to fly to Africa and do things and look at things around there. And in the end, he eventually said, "Okay, I'm going to take my vaccination. It makes sense." He's also high risk as well, so he went. So what's interesting is people's decisions as to why they take it or not is almost like nothing to do with the data. It's actually based on their personal experience. And actually, coming
That
back to
is
my mom,
data, right? It's not the full
yeah,
data,
I
but
guess
it
so.
is
I
data.
guess so.
It
Yeah,
is data. It's just not the full data, and
yeah,
I think that is really true, right? It's all about what you've experienced or seen. If you know people that have passed away from it, you have a view. It's just the same way as a lot of people not taking the vaccination, right? They might see someone that's taken the vaccination and had a side effect, and that might be the data point in which they're using not to get vaccinated, right? Even though, yeah, let's switch on to the next.
I think for me,
Yeah,
maybe one thing we could probably speak on is what we haven't basically spoken about is the age groups. So I
yeah,
think for me personally, my standpoint has been if I had to anchor it to one point, the recovery rate, which I know is not a data that's shared
mm,
as much as those who actually have contracted COVID, is
mm,
extremely high for
mm,
people, lower than 40, for example. So
mm,
my thinking or my position is pretty much, like other flus or illnesses, you sort of, if you contract it, there's a high chance you're going to recover. So I think
it's the recovery. I think is true. But one thing that you should look into, and I advise the listeners to look into, is what they class as long COVID. So is you recover, but the impacts it has on your lungs. So they do like the X-rays of someone that didn't have COVID and someone even in their 30s, etc. And you see the impact, right? And I was listening to a few podcasts, and what they try to take into consideration is whenever you think about COVID, you shouldn't really think about not just the people that died, right? Is the loss of lifetime. So the way you look at it, let's say for example, if you didn't have COVID, you would live up to 60, right? But you caught COVID, you recovered, but now you only live up to 40. You've technically lost 20 years of
but
someone's
let me ask you a
useful life.
question,
Yeah.
because COVID only came out last year. So how are they able to present that kind of data?
You're not able to truly present it now. It's going to be a future, like the future.
That's what they're
state is gonna-
basically saying. They're saying there's a
that's
loss of life.
life capacity in terms
But
of it.
I'm not
Daniel,
trying
what about Daniel, maybe you
to.
want to share your position.
Oh, about the adoption rate.
No, as of why you haven't taken it, or
Yeah.
Oh, many factors. But no, I'll touch on them. But before I forget, what I was gonna say is, it's funny how they talk. I'm not saying the vaccine's a bad thing. I'm not saying if you've had it that's bad. I'm grateful that we even considered and being able to receive the vaccine. There are many countries where people really want the vaccine and don't have access to one, but yet we have it and have a choice. So I do sometimes feel as though I'm being selfish because I'm being offered one, but I'm still saying no, where there's others who aren't even offered, but they would like one. But why don't we talk about improving our own immune system and eating and adopting a healthy lifestyle? Why not promote that rather than just saying have a vaccine and live the way you were living before? Because if they're saying that people from Black and Asian ethnic minority groups are more susceptible to catching and contracting COVID due to our lifestyle, due to our diets, why don't they then suggest we change our diet? Why?
Because it's
are they
harder
not
to do
addressing
that.
that?
So that
It's harder,
Daniel is the
but
right.
it's harder,
is the
but
right
long
thing to do.
term, it's harder,
It's-
but long term, it's short term
everything you-
pain for long term gain.
Everything you're saying, I agree, but it's harder based on the fact that trying to look how we're trying to get people to even do the vaccine. If you're trying to change how people live their life, that's going to be harder. Also,
But then when you know the benefit, when you know the health benefits,
economically, how can these? Let's be honest, right? They talk about if you want to eat healthy, organic food and whatever, there's a price premium on it. A lot of these communities and people cannot afford to change their diet based on economical structure.
you can make marginal changes rather than using palm oil or some vegetable oil. You can start using some avocado oil. Those are marginal changes which have a big impact. But touching on your question about why I haven't adopted or been vaccinated yet is because I'm not against being vaccinated. That's one thing. I probably will at some stage, but I don't feel that I'm in the need or a rush to do it because of traveling or something like that. When the time is right, I will. I do still think it's quite early where the true side effects, and of course there are extremes and everyone's different in terms of how they react to it, but it's not I don't necessarily think that the media or whoever's going to say, no, this is what a side effect of someone who had took the vaccine, because they don't want to scare other people who are about to take it. So there are probably some detrimental side effects just with any vaccine, but they won't show it or glorify it because it will put fear into people and prevent people from maybe taking a second dose or even the first dose. So I'll stop at that to that level.
And for myself, the reason why I decided to take it was just more parents are at that age. So one, I wanted to protect my parents in regards to visiting and seeing them. Also, my mom worked in the healthcare. She was a nurse for a period of time. So it reached a point where I was getting weekly calls from her saying, hey, when are you getting your vaccination? When are you getting your vaccination? I was the last one out of my siblings to get it. So they had already received it 3 months before me. So again, I thought like that data point showed me, okay, in my in my gene pool, there's no side effects because it would have most likely. So I use my brothers as test patients in that sense. And then more my view on in regards to, I think when people think about vaccinations, even if it's not correct, right? I think automatic, or even if it's not doesn't work, automatically people think you're gonna have a side effect. But no, it might just not cure the vaccine. It doesn't now mean that my kids are gonna have X, Y, and Z or whatever. That's the worst case scenario, right? And I believe that the advancements in technologies has increased in such a way that they can create this in a quicker period of time. So yeah, that's really my main. I'm not gonna lie to anyone on this podcast. Based on like the rollout, I haven't really enjoyed it, like, especially in America, more in America than the UK, and in the ways they've been trying to convince people to get vaccinations. I haven't really liked that element. It's got me a little nervous with like paying certain artists to make songs and that to do vaccinations. But yeah, the main reason for me was just mainly because of protecting my parents.
P, you want to go next?
Oh no, I said why for me. The recovery rate is almost 99.9% for those lower than 40. So I'm just thinking about myself, Lauren, Karim. I feel like it's nowhere near as serious as it's been portrayed for people of our age. That's what. But Olu's point is a great point, because you don't just live in this world by yourself. You actually have elders who are in high risk. So how do you manage that?
So yeah, so because I'm in a similar boat to
trying to travel, fam. Come on, just break it down. Share them.
I'm trying to live that life.
No, but there's two reasons. One was actually because of my parents, and because whenever
Sure said what?
Where's that vaccine passport? I'm ready to travel.
Sure said, hang on a minute. So I can get to my countries and reach my target of 60 countries if I get vaccinated. Go on, sure.
So there's an element to that, Pete. There's an element to that. I don't think I slapped my arm that hard though. One piece was definitely with my parents, even though they are vaccinated, and I think there's already been proof that if you are vaccinated, that doesn't mean you cannot get COVID, and we've seen that case now, right? It just reduces the likelihood of hospitalization, all this stuff. For me, the first reason why I wanted to get it was because of my parents, to protect them, and I wanted to still spend time with them, etc. And then of course the other reason is that I'm someone who does enjoy traveling and everything, for my own mental health and well-being, and if getting the vaccination would make that easier for me, then that was also another point of getting it as well. Because I've taken, I think in the last year I've taken about probably 50 COVID tests, and it's getting a bit boring, to be honest, but you have to do it if you want to travel. But hopefully getting the vaccination makes that easier.
Yeah, my dad was
also the one thing I was going to say is there was in the 1950s, late 1950s, there was a drug, a drug named thalidomide, and it was to help pregnant women with nausea and morning sickness. And that was a rapidly approved drug, which was quickly withdrawn in 1962 due to malformations in newborns. So many people at the beginning of when this COVID vaccine was introduced, many people drew parallels to saying, in the 1950s, there was a rapidly approved drug which was quickly removed because of malformations in newborns. That, again, we don't know the true side effects. And because, Ollie, you said, you use your brother as kind of guinea pigs in your gene pool, but you don't know the effects that might come in 10 years, 20 years time, where a guy's on TV saying, did you receive the COVID vaccine in 2021?
But I would also, Daniel,
technology is a lot different now.
Exactly. If you think about how they used to treat certain things back in the day versus now, it's completely changed, right? And let's be honest, every single person on this call has used one form of vaccine. Like, you've taken some sort of vaccine, if it's to travel to a specific country, or if it's for when you were in school, certain vaccines that you needed to take in primary school, etc. So
those are different types of vaccines. Those are vaccines where they actually put part of the virus into your body to build up your antibody for secondary response. Whereas, but the COVID vaccine isn't. They don't put anything in.
No. It was made two different ways. There was ones that. Let's not go into the details because neither of us are. Again, we're just people with degrees.
Sounding a bit techie.
Yeah, trying to be scientific. Yeah. But I think moving on, I think Shawal, you mentioned something quite interesting, right? So as you travel, there's certain vaccines that are mandatory that you have to take to travel to certain countries, and we are starting to see lots of restrictions when it comes to sort of COVID. If you're not vaccinated, you're not allowed to attend these different events, etc. I wanted to get you guys' views on, should the vaccine be mandatory? If the data is saying that, look, for us to protect the economy, or sorry, protect the community, right? We need our population to be vaccinated. Do you feel like it makes sense for them to put a mandatory order out that we should all be vaccinated? What's your views? I know P's probably got some strong views on this.
No, I was actually just looking at what's currently trending at the moment. There's a push for all footballers to be vaccinated, which is interesting.
Should it be mandatory?
This is a very tough question.
This is a tough question. I'll tell you why. Because I can't recall a time in my life where something. Well, hang on. Does that even make sense? I feel like I can't recall a time in my life where we were, as the public or as citizens, were forced to take something in order to live our lives. Does that make sense? So it's almost like it's new territory.
Would be one. If you want to go to certain countries, now obviously not everyone travels, but to go to certain countries, you're not allowed access unless you're vaccinated. That is a perfect example of it.
I don't mind going first quickly on this one. On this, I think it's tough. Personally, I don't think it's right for anyone to say that you have to mandatory do any form of a medical procedure if you don't want to do it. Now, if there's a service, or for example, travel, if you want to travel, then you need to either be vaccinated or show a negative COVID test. I personally think that's okay, because I've just got used to doing it now. And then you can have the choice of whether you want to be vaccinated or whether you don't want to travel. Or if there's a private event and the person running the event is a private owned company, and they've decided, we're going to run this event, but we're only going to allow vaccinated people or people with a negative COVID test. Again, I think that's okay. When you start to say we're only going to allow people who are vaccinated in, that's when there's a bit of a gray area for me personally, because then you're kind of forcing people to do it. Or do you see what I mean? It's difficult. I don't think there's a right or wrong answer. It's just a bit of a gray area.
I think yeah, I agree. I was just thinking, guys, question. Is it mandatory to take a malaria jab when you go to Africa?
You don't get. There's no jab. You get tablets. There's no vaccine for malaria. That's the whole point. That I'm trying to say is that it's just.
But
you
the
just get
best one is
anti-malaria
China.
tablets.
I remember when I had to go to China, I had to show
Yellow fever.
proof of yellow fever vaccination, and there was another one that I had to show proof of. And there's certain other countries that you have. They want, like at the airport, you need to show them proof that you've had it.
Otherwise,
Yeah,
when like South Africa.
When I went to the south of Brazil, near the Amazon rainforest, there's a high prevalence of dengue fever, so you had to take a vaccine to be allowed to travel to that part of Brazil.
But
so I think, I just think, in short, I think the same on Shua's point, it shouldn't be mandatory, but I think I don't know, depending on the event or depending on the circumstance, some people can decide they want to have only vaccinated people, and then other people that are not vaccinated maybe to accept that.
But that's where it becomes discriminatory, because a lot of places and venues are saying, okay, if you're fully, double jabbed or partially jabbed, you're allowed. But if you can show proof of a negative test, then also you're allowed. I think that's fine. When you now start saying, if you haven't got a vaccine, you can't come, that's when it becomes discriminatory against your human rights, because the vaccine isn't mandatory, and I don't think it should. I think it should be a free will. I think we've always allowed ourselves to say what we allow in our body and what we don't. So if we're now forced to take something which we shouldn't, or which we choose not to, we shouldn't be held against it, because it's like saying, everyone's pointing the finger at me. I look like I'm, trying to do harm.
I think Shua mentioned before, that even if you're vaccinated, and this is where I think I want to get you guys' views on it, right? So you're saying just because I choose not to use it, right, or use the vaccination, shouldn't mean there should be laws to discriminate against me, right? Now, if there's data, which there are, right, to prove that people that are vaccinated can still contract COVID through people that are not vaccinated, right?
And
What
wait, so
yeah,
pause there.
yeah.
Does it also show that people who are vaccinated can contract COVID from people who are vaccinated?
Yeah, but I don't I would assume so, yes. But I would assume you reduce the risk, right? If everyone, the point of us all getting vaccinated is right, so the virus can't live in us, right? But if you've got a population that is not vaccinated, it's circulating and it can just hop over to someone that's vaccinated and being passed. So when I think about that concept, right? Initially, we introduced a government introduced a law where they banned smoking in buildings, right? The reason they said it was not because there was a back in the day, everywhere you went, you saw smoking. But what they found was that second degree smoking is harmful for individuals, right? So they said, what we're going to do is mandate that in any indoor environment, you are not allowed to smoke. So wouldn't that same concept be with them having laws where they say we've shown all the data to prove that you are harmful for the population that are vaccinated? So we are going to say now that in certain events, unless you, like, I agree, unless you can prove a negative one, I think it's still fine. But they can go to an extreme point and say we are not going to allow you into that venue because you're not vaccinated. Isn't that the same?
If it's negative, fine. But if it's not negative, that's discriminatory because you can't say, secondhand smoke is you're smoking. You're clearly visibly smoking. Just because you're a person who hasn't been vaccinated doesn't mean you are COVID walking. You're not a walking COVID.
But if the issue, what would you have an assumption that someone is, if you can't prove that you're not, because the issue is not around if you can prove you're negative, you can go to this event. I'm saying I'm gonna go now into a little pub, right? There's no way that I know if I've never taken a vaccine COVID test, so I don't know if I'm positive or negative. So me as the establishment that owns that place, for me to take away all liability on my side, because you can't prove if you're positive or negative, right? Maybe in that scenario, I treat it like smoking and say, sorry, you're not allowed in because there's a chance that you could pass on the virus. I'm just devil's advocate, throwing it around. What's you guys' views on that?
Yeah, but that's okay. I to be honest, this one is a mad one.
It's a tough question.
I don't even know what I'm going to say. I think I was going to react with. Go on, Daniel. Go ahead.
I've said what I said. What I said. That's what I wanted to say. I don't really have anything more to say because the government. The thing is, the government can and will do whatever they want. The government can and will do whatever they want with respect to this vaccine. Like ᴠɪᴇᴡs was saying, where they're going to force it and make it mandatory. I think earlier on he said something about mandatory or not allowing people to do certain things. They will do that. You won't be able to go to certain events. And I think they're now looking at more youth events. So when it comes to festivals, music events, concerts, football matches, etc., because they now want to get the younger generation populated. So now they're looking at what they do for social activities and amongst their friends, that, okay, these people are going to want to continue enjoying their social lives, that they will now need to be vaccinated in order to do so. P, you were going to say something.
No, I'm now going to say. I was going to say actually. This conversation is making me think about what it's going to be like for those who decide not to get vaccinated, and how they're going to be perceived. They're naturally now going to be perceived, because I have no problem saying in a public venue or whoever I'm speaking to, I'm not vaccinated. But now it's going to seem as if I'm the dirty one. I'm the one that hasn't washed. I'm the one that hasn't brushed my teeth. I'm the one that hasn't. You know what I'm saying? So I think what's interesting, and only time will tell, is if you like, even how you develop your network and establish relationships. That might even become a topic of discussion. Like, was you vaccinated? Are you vaccinated? I know someone, I won't mention his name, who's thinking about getting vaccinated because he's now starting a new phase of his life. And where he's going to next, he actually doesn't want that to be something held against him. Imagine, he wants to, if they start talking about, he thinks the likelihood that everyone else being vaccinated is very high, so he wants to put himself in that position and doesn't want to be seen like the single one out. It's almost going to get to a point where, forget black, white, or what your race is. Are you vaccinated or are you not? And we're going to judge you on that. So I just think it's interesting, because I'm also on this call, and I'm looking at you two guys, and I'm thinking to myself, What you guys think you're clean and we're dirty? Is that how you guys are thinking?
You're looking at us differently.
No, I'm wondering.
But that's true. That's true.
I'm wondering if Olu and Shaw are thinking, hang on a minute, maybe we shouldn't continue our relationship with Pavilo and Daniel because these guys are
What
not
I'm saying,
vaccinated.
if we were doing it in a studio and we weren't virtual, I might take you outside and
But
say, hey, these guys need to be proven they're negative every session.
But now, for example, and this is actually a deep topic because if I go back to the points you mentioned, Shaw and Olu, as to why one of the reasons as to why you got vaccinated was because to protect your parents. So let's say, for example, I've flown to the UK. I've got my lovely family with me, carry my beautiful child, my wife, incredible, and we come to see you, Olu, at your mum's house. Are we allowed in?
You can, but I might have like distance, mask, certain criteria where it'll keep them safe.
See, it's
especially the fact that you've just traveled, right? You've just traveled, so the risk of you contracting is also higher. Even if you were vaccinated, I'd probably still say, hey, maybe certain level of distance, right? And I think that's just you. Like, let's say, for example, if I was to go this weekend, I'm going out partying, right? I'm not going to go and see my parents the next few days after that. I'm going to leave a certain space before seeing them. And it's just, again, me being responsible, just based on the climate that we live in. But
interesting.
I understand that. Why didn't we do that with flu and colds, though? Why didn't we do that with flu and colds? Because we can easily pass and transmit them on. And just because we weren't necessarily understanding that how detrimental it can be, especially in older age, we would still go to work and pass on colds and flu.
I think the difference with flu and colds, and then all you can give you a take, is with COVID, we have, and again, I'm just speaking from personal circumstance, family friends that have died because of it quite suddenly, unexpectedly. And I think that firsthand emotional feeling connected with an illness always will change the perception of it. Whereas with flu and colds, there's people that have had that. We've had that in our lifetime, but I personally don't know anyone that's died from it. And I think with COVID, again, if no one in my family's circle had got it and died from it, then I probably would have been like, oh, it's all fake. Again, I'm just basing it on personal. That's what I think the difference is versus the other illnesses in the past.
And I think when you get that message, right, that someone that passed away from it, you're like, shoot, like that person was, in my mind, even like some people I've heard, I was like, no, that person was healthy, like there was nothing wrong with like you. And then I don't get that same call when it comes to colds. And also, again, go back to my previous point about how it transmits itself, the airborne element of it in terms of flus and stuff like that. And which we do advise people, when you have a flu, don't come to the office. Like, you have distance. If I see someone sneeze, I'm already backing off from that person. I'm not trying to touch their hands. So there's those elements. But why don't we switch over to what next?
Just before we switch over, just same question to Shuel. I've just landed in the UK. I've called you up. Okay. I'm on my way. I've got my family in the car. We've brushed our teeth. We've washed ourselves. What we said? Am I able to dap up your dad or not?
So do you know what when you were asking that question, P, it's interesting because when you were asking that question, I hadn't even thought of that scenario. So before you asking that, if, let's just say, imaginary, next week I was back in the UK and you were like, oh sure, we're planning on coming down south near Portsmouth, I'll just come around, I wouldn't have thought about it. But now that you've asked the question, I would think about what I would do. Now that you've asked that question, probably what I would do is I'd probably do what Olu said and say, just wait a few days and then see.
Or
and it's interesting if you
outside,
No, because thing is, I wouldn't. For me personally, I wouldn't do that because I think if it's like that, then there's no point for them or anyone to come around because you can't get the same physical interaction with each other, and that's the main point of why we're seeing each other anyway. So I'd rather, if we do it properly, and that means Karim's getting busy in the kitchen, everyone's touching up all the food. We do it like that, or we just don't do it at all. But yeah, now that you've asked that question, P, I don't know what I would do, if I'm honest. I wouldn't have thought about it before you've asked, but now that you have asked, I probably would say let's do it after another week or so of being back in the UK. But then during that time, you're probably going to see other people. So yeah, I don't know. I don't know what the answer would be.
Decisions. Olu.
So why don't we switch up just to the final question? Just where do we think this is going to go? What next, right? So I think we're all in agreement, me personally also, that we shouldn't make vaccines mandatory. I think we're all in agreement there. Now, for me, I think where we go next is we continue not to make it mandatory, but we do ensure that there's guidelines and safety procedures. So either you prove that you're negative or you prove that you've been vaccinated. Now, I think you continue doing that unless more data comes out that there's a new variant where it's more deadly. And I think depending on how the data continues to progress, if we do find out that something is more deadly and can be transmitted quite easily, then I do believe that there might reach a point of time where you need to say, if the vaccines have been tested for a period of time and they don't show a massive negative reaction to it, that hey, the whole population has to be like, if it gets to a severe rate. But I think you just continue doing how it is right now, showing that you're negative or showing that you've got a vaccination. Shiwa, what about yourself?
No, let's get Daniel or Pabilo to go next, and I'll give my take.
I can tell you exactly when this will all die down. I can give you the year. I can give you around what time in the
Everyone
year.
said it'll be gone in a year. It's still here.
No.
I could be quick.
So far, everything's on track. it's still, go on. Then you go.
How I think what I think what's going to happen. I think later this year there'll be another lockdown for another push to get more people vaccinated. I think there's going to be another lockdown this year, and they're going to be a lot stricter in where people can and can't, what the unvaccinated can and can do in terms of socializing and going to public events. Maybe I'll be vaccinated by then.
Okay.
P.
Yeah. What next? No, I'll keep my
conspiracy
honest reflections to myself. But I think no, look, I just hope this dies down like Ebola. That's all I'll say.
Okay.
This goes away like Ebola.
Okay.
Sure, go ahead.
No, so I think with the vaccinations, just looking at the statistics, the people who are most at risk have actually got it done, double jabbed and everything. So I think if that's the population that's most at risk and that suffered the most in terms of number of deaths, then I think overall we're in a much better space. The number of cases will probably go up at some point again around the world, but then eventually it will flatten out and we'll get back to normality. It's just a shame that the whole vaccination rollout has become really this kind of political topic, this emotive topic to divide people, when I think if it was managed properly, it shouldn't have done. But that's where we are now. And then
Totally.
Actually, I will say this
point.
Let me say this point.
I think I just want to mention, right, especially for the listeners, you could see that we've all shared different views. 2 of us have been vaccinated, 2 of us haven't, right? And there's no anger, there's no, hey, when I get married or whatever, you guys are not going to be invited to my wedding. That's not the sort of dynamic of the conversation, right? I think the way we've all got to look at this, the way we've all got to look at this conversation is that it's a choice, right?
Yeah.
At the end of the day, it's a choice, and we all have to live with the risk in which we're taking, right?
Do you think
The
choice to be vaccinated or not vaccinated speaks a lot about the individual? So, for example, let me just quickly say this. Ollie, you've now learned that myself and Daniel have not taken a vaccination.
Yeah.
It'll be interesting to understand, not that you tell us, if you think about, if not your perception of us changes, but if you think about, if you look at us differently in terms of how we make decisions. Yeah, that's all I'll say. Not something to answer. I'm just saying. It's continue.
It's funny you say that, because I was talking to a friend of mine. Should I even expose? No, let me not expose the person.
No.
And I was like, I could tell you're someone that wouldn't get vaccinated. It's what I said. And it's funny, you do obviously have that preconceived, like, okay, this person might be someone that listens a lot more to social media versus other stuff, right? But no, you two, there's no judgment there. I just think at the end of the day, neither I'm gonna say is right or wrong. At the end of the day, is a choice, and both parties have to live with their choice. If you don't get vaccinated, there's higher risk based on the data that you might catch COVID. Hopefully, it's a mild one. And if you do get vaccinated, right, there's less chance that you might get the vaccination, but there's still a probability that maybe it was rushed. There might be certain side effects, right? So we both have to live with our risk and what we decide to undertake. And as long as it's calculated and informed, we can live with our decision.
Yeah, actually, the only thing I wanted to say in terms of what next, because I think it's a loaded question in the sense of there's so much you can say. The only thing I will say is I just hope actually in the near future that families and people are able to connect. I think this has done this has broken people down. This has separated families. This has kept people apart. And I'm not sure what's coming next in terms of what Daniel's talking about in terms of a lockdown and things of that nature. I just hope whatever is coming next, it just allows people to
Totally agree.
spend more time with family, right? In whatever capacity or form that is. And I think that will help us get through whatever else is on the horizon.
Perfect. Cool. So thank you for listening to this episode. I hope it was informative. For our listeners that stayed to the end, I would just like to put a disclaimer. We're not scientists. We like all of the views are just our own personal opinions. Hopefully you learn some things about us, have some things to go away, research, talk to people that are more informed experts, and then you can make your decision based on that, right? So thank you. Passing it over to Daniel.
So thank you all for listening. Hope you're staying well, staying safe, testing negative, staying positive. Stay safe. God bless. See you next week for episode 92 or Take Flight Takeaways.
Peace.
Take off.